Bismillahirrahmanirrahim. Assalamu alaikum. Here is Iman Mukhtar, seat number BP1650087. Let's get started with the presentation related to my drug chloroquine. Chloroquine, class 4-aminoquinoline. Indications included used as prophylaxis or in treatment of malaria. It belongs to a class called antimalarials. Despite it also used to treat infections caused by different type of parasites like in treatment of intestinal amoebiasis. In treatment of uncomplicated malaria due to susceptible strains of P. vivax, P. malariae, P. ovale and P. falciparum are the plasmodium species of malaria. It is not used for the treatment of complicated malaria or for malaria prophylaxis in area where chloroquine resistance has been occurred. Chloroquine is now, however, replaced by with other powerful drugs because of their potency and chloroquine resistance. Okay, here we have the comparison between chloroquine and recent antimalarial treatment or practices. Chloroquine is used as chemoprophylaxis or in treatment of sensitive malarial species and also in treatment of other infections caused by intestinal amoebiasis infections. However, the recent antimalarial practices are used for severe malarial conditions and in cases where resistance to chloroquine has been developed. The most recent antimalarial used for treatment are in combination therapies and are called ACTs, called as artemisinin-based combination therapies. Okay, what is malaria? Life cycle of the malaria parasite. As we know that Plasmodium is the cause of malaria. The mosquito injects the parasite when it bites the human in the form of sporozoites. As Plasmodium enters into the blood, they will convert it into the sporozoid form. This sporozoid attack to the liver tissues. Hence, the liver tissue will burst out and the gametocyte will form. The gametocytes form zygote after the early mosquito stages, and the late mosquito stages include oocyst, and hence the mosquito ingests the parasite during blood feeding. The next cycle starts when the next mosquito ingests the parasite during blood feeding. This how the cycle continues and continues. Rational use of chloroquine. Rational use of medicines requires that patients receive medications appropriate to their clinical needs in doses that meet their own individual requirements for an adequate period of time and at the lowest cost for the community. Chloroquine used as treatment and in prophylaxis of infection with sensitive parasites of malaria, also giardiasis, rheumatoid arthritis, amoebic liver abscess conditions with specified duration of medication dose. What are the side effects? Side effects of chloroquine include cardiovascular side effects, including cardiomyopathy, abrupt fall in blood pressure. CNS side effects includes insomnia, neuromyopathy, ototoxicity. Ocular toxicity includes retinopathy, blue-black pigmentation, also edema. Long-term use of chloroquine can lead to the severe side effects include myopathy, peripheral neuropathy. Intolerance included nausea, vomiting, allergic or hypersensitivity reactions, or photosensitivity. Chloroquine toxicity. With an overdose, patient may suffer from headache, drowsiness, cardiac arrest, respiratory arrest, hypokalemia, QRS prolongation. Okay, what is the chloroquine mechanism of action? As we can see that hemoglobin will convert it into the heme, and heme will convert it into the hemozoin by the enzyme heme polymerase. With the use of chloroquine, the chloroquine stop the polymerization of heme, and heme will not convert it into the hemozoin. That's how the highly toxic compound heme will accumulate, and which is highly toxic for malaria parasite. Chloroquine interactions included drug-drug interactions, also food interactions. There are some drugs which ultimately causes drug-drug interaction with chloroquine. Some drugs may interact with chloroquine. They are the combination chloroquine plus mefloquine are contraindicated because there are risk of convulsions. Other combination is chloroquine plus remdesivir. Their co-administration is not recommended owing to antagonistic effect on remdesivir malarial antiviral activity. Chloroquine plus tamoxifen can also lead to the retinal toxicity or ototoxicity. Food interactions included that chloroquine can be taken with food. Food reduces irritation and increases bioavailability. So this is better for chloroquine to take with food. What are the contraindications? Contraindications include psoriasis, porphyria, retinal field changes, seizures, hepatotoxicity, arrhythmias. Okay, what is the dose of chloroquine? Here are some doses, forms and strengths of chloroquine in pediatric, adult type of dosage, form present in pregnancy or in renal impairment use. As we can see that pediatric tablets are present in 80 mg OD, dose is OD for 5 days. Adult dose can be present in 150 mg, 200 mg, 310 mg, 620 mg OD for 5 days. Syrup, suspension and injection forms are also available. Injections preparation must be stopped as patient conditions permits. They are present in severe doses. In pregnancy, the radical cure with primaquine should be postponed until the pregnancy is over. Instead, chloroquine be continued as adult dose 310 mg each week during pregnancy. Renal impairment, chloroquine is only partially excreted by kidneys, and reduction of the dose for prophylaxis is not required except in severe impairment. Here are some alternative brands, drug molecule in that brand, drug form, and also the cost effectiveness with the price, retail prices. Here we can see that different alternative brands of chloroquine are present, like Benacoin, Resortion, Chloroquine. They all are present in different strengths for drug molecule of chloroquine and in various drug forms with the cost effectivity. Irrational use of chloroquine. The use of any drug or any type of medications, the use of antimalarial in absence of malarial infections, or the vectors that transmit the disease, or not properly diagnosed conditions. As a result, the continuous use of such drugs result in unwanted side effects. Better training of healthcare professionals is needed to ensure proper diagnosis of malaria or any type of disease, and appropriate prescription of anti-malarial drugs to patients, and prescribing to follow proper pharma guide and avoid to follow polypharmacy. Okay, here we can see that our case study related to the malaria. 26 years old male complains of high fever with backache and recurrent nausea and vomiting, and feeling very lethargic, also having continuous headache. He is admitted to the XYZ hospital. Patient demonstrates, and devoid of any past medical history, Patient is conscious, oriented, and is non-alcoholic and non-smoker. His systemic exams are normal. His other testing includes for dengue is negative, polymerase chain reaction positive, and MBQPC test is positive for EVAVX. The patient is however diagnosed as malaria patient. The other lab tests are as follows. Okay, here we can see the observed lab results of the malarial patient with the patient drug history recorded, which states that IV fluids are administered for 2 days, doxycycline 100 mg for 5 days, Dolo 650 mg TDS for 1 day, Larago 600 mg for 5 days, and Amisat injection 4 mg is that for 5 days. Now, what is other prescription does patient need, how to manage his condition, and what are other lifestyle modification you may suggest for this type of malarial patient? Here we have a soap nose for our patient. Our main subjective that age of the patient is 26 years, male, which complains that having high grade fever, headache for 3 days. Signs and symptoms include nausea, vomiting, fatigue, and continuous backache. Patient is however non-alcoholic and non-smoker. Past medical history of the patients have no previous clinical medical history, means having no past diseases or any type of medical history. Current medication which he relies upon is follows: IV fluids, doxycycline, chloroquine, Dolo, Larago, Amisat injections. Our objective: BP he having is 130 by 90 mm per Hg. Temperature is 104 degree Fahrenheit, which is very high. Patient is focused, oriented. However, his physical appearance is good. He is well oriented. His lab results are negative for dengue, positive for MPQPC test and PCR, low levels of HB and platelet count, increased ESR and POT test, increased bilirubin. Assessment which we assessed is MBQPC and PCR positive, which shows that there are chances of parasite in the blood and most likely to having malaria. The low levels of HB and platelet count and increased ESR and POT, which is due to the low plasma and low level of RBC. ESR got increased in 70% of cases in PVVX infections. Increased bilirubin reported the liver enzymes leakage and bilirubin increase with increase in malarial parasite density. Usually in uncomplicated malaria, raised bilirubin is mainly due to the hemolysis of parasitocytes and non-parasite RBC or hepatocyte damage. Patient is taking chloroquine 500 mg TID for his malaria, which needs to be substituted with other potent anti-malarial, as chloroquine resistance has been developed, which needs to be subsided. The plan for malarial patient is medication plan that patient prescribed to be shifted upon ACTs, artemisinin based combination therapies, as he have developed chloroquine resistance. The artemisinin combination therapies includes number one example is artemether, lemifentrine, and artesunate mefloquine. Quinine with doxycycline can also be given. What is the discharge advice? Artemether, mefloquine, doxycycline 100 mg BD for 7 days, Dolo 650 mg stat. Also, patient is recommended to review after 14 days. Patient counseling. We counsel patient to take adequate rest, to drink plenty of water. MBQBC test recommended after 14 days. Prevention, how to prevent from malaria. Mosquito nets are must be used in night, or keep your surrounding clean to avoid any type of infections, mosquito repellents to avoid mosquito, and vaccines for malaria are also underdeveloped. It is also recommended to apply hygienic conditions and to apply normal state of lifestyle or healthy lifestyle. Okay, that is over now. Thank you.